let's jump into what exactly psychopathy is and how you would diagnose it. How would you recognize it? One of the main criteria for evaluating this or assessing this is the Psychopathy Checklist. And that was created by Robert Hare in the 40s and revised in the 70s. He had 20 characteristics on this, and I'm just going to shoot them out to you so that you can think about whether or not you've seen this or recognize it. And we can't diagnose somebody from afar. We can't diagnose someone if we're not a clinician and they're not in our treatment room. But it gives us some awareness and some insight into this condition and how to think about it. If someone is superficial or glib or charming and has kind of a surface approach to relationships, that might be one thing. Grandiosity is another quality. Seeking glory as well. Deceiving and lying and manipulating. No remorse, no empathy. There's a way in which these people can just move through situations and people's lives and not really take in how what they're doing or how they're treating that person is really affecting them. No sense of responsibility, a kind of a recklessness, impulsive and spontaneous and exciting in many ways, but there's a dangerousness to it. There's poor behavioral control. And there's something about the future and being able to really integrate the future or conceptualization of the future into the everyday. This person may lack very concrete goals, or even if they have them, not have planning around it or poor planning around it, not really understanding the depth of the situation, what can go wrong. There's an overconfidence in creating plans if plans are created, and assuming that everything is just going to go their way because they're able in their mind and confident and not really capable of failure in their mind. There's also some evidence of what we call antisocial behavior, doing things that are without conscience, not having regard for other human beings or for laws or for rules, and actually not even learning from punishment. And we'll get into that in terms of treatment, but there's a way in which the punishment or the negative feedback is not a deterrent. It doesn't seem to matter that much. There's a need for high stimulation and an intolerance of boredom. Many of us like some quiet time, some relaxation. We don't want the constant input. And boredom for many of us allows for reflection and for contemplation and for a gathering and a reorganizing of our psyche or our day. But they just want to keep going. They need this stimulation. As we said, there was a manipulative quality too. What we call shallow affect. We kind of covered this before with the superficiality. There's also something called a parasitic lifestyle, a way of exploiting other people, melding and merging into what they're doing and taking from them. And there's a kind of perhaps exhilaration that comes from being able to achieve that. Relationships tend to be fleeting or short-term or not deep. There's a kind of a disloyalty. And there may be a promiscuity, a sexual promiscuity, or, another way to think about that is a kind of a duplicitousness, or people don't even really mean that much. Or if they're looking at you and they're very focused on you and very in the present with you and you feel like you're the only person in the world, in 2 seconds they can be doing that with someone else. So it can be deceptive and hard to understand because it feels very real. There's a sense of sort of mimicking a depth when the depth isn't really there. Those are some qualities and ways to think about it. I would say that one of the things that's very difficult for people who are in intimate relationships, whether it's your sister or your parent, you might be married to somebody who has this, it can be very confusing in terms of your inner life, how you respond to them, because there's a way in which you can get very caught up and emotionally seduced, excited, trusting, believing, and maybe there are moments and times when that is actually reasonable. But there's a sort of a betrayal or disloyalty that's operating in a chronic way beneath the surface that can create a disturbance in you if you are tightly connected to someone like this. And you may not be able to identify it. You may not be able to really know why you're feeling badly or a little bit down or a little bit depressed. And There can be sort of overt manifestations of this where someone can be mean and cruel in a very direct way, but they can also be passive aggressive, and there can be an insidious kind of trauma to the person, to the loved one. So these are things that we want to think about. It can be profoundly frustrating to be in an intimate relationship with someone like this because you have a sense of ineffectiveness. You have a sense that when you try to communicate or talk about what hasn't worked or what's wrong or what's troubling you, which is sort of the Psych 101 of communication in relationships, it doesn't really work because they're not dealing with reality. They're in this kind of, not actually psychotic, which means not in touch with reality at all. That's not the same thing. But there's a slightly delusional quality, a grandiose quality to them, which makes them have to deny certain experiences in the world for themselves or for other people that would diminish them in their own mind. So it's very important that they have this elevated sense of self. So it's very overlapping with the diagnosis of narcissism in many cases, not all cases. We can also take a look at some of the biological features of this. There are some differences in gray matter and the size of the amygdala. And so that's also very relevant, and a low resting heart rate. So these are things that we look for.